Yeah, so we're going to switch gears a bit here. And, I don't need to convince this audience that research is important, right? We've seen several people talk today and everybody's showing us results from research studies. And we know that we need clinical trials. Trials are also a form of research. And, I think when most people think about who does research, you think about people who are in universities, you see people who are in biotech companies and pharmaceutical companies. And if you were just to think about it and say, who actually funds the research? Some people might think the university professors are being funded by the university, right? Universities have a lot of money, so universities must be spending a lot of the money for research. Of course, we know pharmaceutical companies have a lot of money, so they must be funding a lot of research. Turns out that for rare diseases like neurofibromatosis, the bulk of the funding is actually from the federal government. Okay, and here's a breakdown of, so we are actually quite, be careful there. We're actually quite lucky in the NF field that there is actually quite robust federal funding. So for example, if you look at this pie chart here, so $40 million from the National Institutes of Health and $25 million from the Department of Defense. This is actually the majority of funding for research that all of these researchers are talking about. All these graphs you see, all these mice you see, a lot of this is funded by these two organizations here, okay? Now, the National Institutes of Health doesn't only fund research for NF, it funds research for all health conditions, right? And so the $40 million that you see there, that represents what the NF researchers are able to get from the NIH. Okay, so you have a lot of researchers who are working in the NF field. They all write grants and they get money. And that's the money I'm talking about when I say $40 million. So theoretically, if nobody applied for grants to the NIH, that year, the NIH would not fund any money for NF. It's not because they've got anything against NF. It's just the mechanism is such that you have to apply and then you get a piece of that pie, okay? But that DOD part that you're seeing there, that 25 million, that is specifically for NF. Right? So, and I'll show you how that works. And so the reason I'm putting this pie up is to say, first, that a substantial amount of research is actually funded by the federal government. And two, this portion that's listed as DOD, that's the part that Kim was talking about. We serve on that same committee, and Dr. Yohei, who just spoke to us about nutritional supplements, he also serves on those committees. And so the point is that I'm going to describe that program to you. It's called the NF Research Program. I'll describe it to you just to give you an insight into how this research funding works, but also what is actually done, how this is actually deployed in a strategic manner. So we're actually developing the field of NF, okay? So obviously you're interested in the research itself, but it might give you some insight into how all of this research actually happens, okay? So this is just the funding for 2020. When we say fiscal year 2023, this is the money that was just appropriated that will be given out over the next fiscal year, okay? Now, the slides are not moving. Okay, and so on this slide, what you're seeing is the same, the same sources I was talking about before, which is the National Institutes of Health and the DOD. But I'm showing this to you over a period of time, okay? And if you notice, the money from the NIH has actually almost doubled in the last decade. So this is 20 million here around 2013, and it's inched up over time. And when we are out here at 2022, 2023, we're up at around 40 million. So this money is growing over time. This is not because the NIH is deciding to give us more money over time. That's not how the NIH works. The NIH money increase is because we have more NF researchers and they're applying for more grants and they're getting a bigger piece of the pie, okay? But this money down here, this is the money that is guaranteed for NF. So this is the money in the DOD panel. Whoops. Yeah, I have control now. So, so this is the DOD pot. this money is specifically for NF, okay? And in 2021, we got a raise from 15 to 20 million. And then I'll show you on the next slide, we've just got a raise for FY23 up to 25 million, okay? So this is really good for the field, and I'll show you how this is actually deployed over this next few minutes here. And so this program is actually called the Congressionally Directed Medical Research Program, CDMRP, okay? And this program is run through the DoD, and it actually has been around for 25 years now. And look at the amount of money there. In this 25 years, over $400 million have been spent on NF research, and over 500 research projects have been funded this way. Yeah, okay. So you know, obviously this has funded a lot of the research over the last 25 years, and we just got an extra bunch of money for giving out in 2024, right? And I just want to say that the vision of this program is to decrease the clinical impact of NF. And when we say NF, in this case, it's NF1, NF2 schwannomatosis. It's not only NF1, okay? And the mission here is to promote research where we understand the diseases better, we're able to diagnose the conditions better, and we're able to treat these conditions. So it's broadly directed to all of these three conditions, okay? And I want to just say thanks to the NF network, you know, all of you guys who are involved in advocacy. All of this money is actually, this increase in appropriation happens because of advocacy. So we were at 15, we're at 20, we're at 25. And I can tell you that when we're sitting in the room deciding who gets the money, when you have 15 million, it is really hard to give the money to all the right people because we run short of money. But by 20 million, it looks good. By 25 million, it's really good. And so we're able to get a lot more research projects funded. And I'll tell you when I say we, what I actually mean by we. In a few minutes, you'll understand why I'm saying we. Can I have the next slide, please? So how does the research fund, how does a research grant actually get given? So the first guy, you can see this guy on the left. He's obviously been working hard. He's losing a lot of weight there. Pass him some chocolates. So he's writing a grant, right? So this guy, he or she is really putting the energy in there, getting the grant out, sending it to the government. But every grant that comes in is not going to get funded, right? Something like 10, 15% of grants actually get funded, okay? So there's a whole review process that happens. Yeah, have the next slide, please. And so this review that happens at the DoD happens at two levels. Okay, and so the level one review is where the grants come in and the scientists kind of sit down and decide, how good is this grant? So they just give them scores, right? And then the second level is called the programmatic level. And I'm going to describe each of these in a little bit of detail, but both of these levels, you have scientists working and trying to figure out which grants will eventually be funded. When I say scientists, I'm actually doing a disservice here because, and something that's really unique about this program, the CDMRP program, is that it's not only the scientists that are deciding which grants get funded. You have what are called consumer reviewers, okay? And just to give you a scale here, so really this is something that is very unique in the DoD program, which is it's not only the scientists. Remember, NIH, it's basically scientists sitting there and telling people which grants are going to get funded, okay? And here we have people who are actually closely connected to the condition, either because they have it themselves or their loved ones have this condition. And they're sitting in there and saying, all you guys might be thinking this is really cool stuff, but actually this is not as important for the community. Or here's something you guys really need to look at and figure out why this is not being funded, because this is something the community really, really needs. And so Kim is on the same committee as myself when we're deciding who gets funded here. And you can hear her, raising her voice up and saying, this is something that the community really, I don't think I have to convince you that she can raise her voice, is really important. And so this is something that really influences the final decision in terms of who gets the money to do the research projects, okay? And so, of course, there's advocacy at the grassroots level and the advocacy at the federal level, which is telling the government to increase the funding. But sitting in the room when the decisions are being made as to what is important and what is not important is a very unique, experience. And especially for scientists like me, when we're sitting in the room and we're listening to people who are that connected with the condition, it really influences the way we think about the condition over time as well, right? And so this is something that makes, I think, this project, this program work really well. So here's the first level. The first level is where scientific review happens, okay? Now, that looks like this. So here's a large room somewhere in Washington, D.C. It's usually in the hotel on the ground floor of the first floor of the hotels. They keep these rooms really cold, okay? And the reason they keep it cold is because these discussions are really heated, okay? There's a lot of discussion going on here as to, because you typically will get something like 200 grants, okay? So you got to read 200 grants. I mean, not everybody's reading each of these 200 grants, but every grant is read by 2 or 3 people and a consumer reviewer, right? And they're going to review these grants and they're going to fight it out to say, this is really good, or this one is really not good. And of course, there's a lot of disagreement, and eventually you're going to rank these things. And what's the magical thing that happens is you get a score, okay? So all of these grants are scored. Now, in that room, you have NF1, NF2 schwannomatosis experts, you have geneticists, you have clinicians, scientists, pathologists, all kinds of people, okay? And eventually, all of these 200 grants are scored. The bottom half of these grants, they say, there's just no way we're going to fund these guys. So there's not much discussion that happens with the bottom half of these guys. The top half of these guys, they go to level 2. At level 2, that's called the Programmatic Panel. Now that's the panel that's sitting there saying, okay, this is the amount of money we have. These are the grants that scored in the top half. Which of these guys are actually going to get funded? So they reevaluated at this time, but we're also doing another thing. We are matching it with priorities, okay? This is a priority. In fact, this year, this is a new priority, okay? So that one gets a better score. Then we have to see, we want some new investigators. We want some really crazy ideas being looked at. And so all of these things get matched with the funding mechanism and the priorities. And eventually we determine who gets funded. So this is the current panel here. And you saw Dr. Yohei just speak to us. He's the chair of the committee. Until last year, I was the chair of the committee. And then you see Kim over here. You see several other people from CTF. You see people from NIH. If I can find it quickly. Down there, here's National Institute of Neurology and Stroke. And so basically you've got these guys deciding finally after all the scores are laid out as to who gets funded. Now, if you look at the past 5 years, about 2/3 of the money has gone for NF1 and the remaining 1/3 has gone for NF2 and schwannomatosis, okay? Again, this is related to the number of grants that come in and how they score. So we're not actually deciding that there's going to be that many NF1 and that many NF2. And it's going to NF conditions, okay? Now, at the NIH, when people apply, it's really dependent on who applies, what type of grant is sent in. They get a score, it's fundable, they get funded. Over here, we're also looking at priorities, okay? So for example, we want to find out basically what is wrong in NF1, NF2, and schwannomatosis, okay? And so studying sort of the basics of the basic research that's involved in these conditions. The other thing we want to do is obviously test for potential therapeutics, right? Somebody wants to test for therapeutics. We're excited about that grant. We want to see if it's being proposed in the correct way, and then we'll fund it, right? We also every year we'll come up with, nobody's applying for grants in this area. This area is really hot in other diseases. Why are they not doing it for NF? So we'll put it out as a research priority, and that'll just stimulate people to kind of apply for those areas, okay? So we identify areas that are critical for working in the NF fields. The other thing we want to do is we want to increase research capacity. Okay, so what do we mean by that? So you want to make better mouse models, for example, right? Or you want to make better probes, better antibodies, so that everybody can benefit from this. It's not only one research group that'll benefit from this. The other thing we want to do is we want to get more investigators into the field. So people who are, really accomplished people in other fields, we want to entice them into coming into the NF space. Come and do your magic in this space, okay? So that's another thing we like to do, is to increase research capacity, not only in terms of making more tools, but also bringing more researchers into the field. So I'm going to show you some examples. So first of all, let me just say that the priorities obviously change with time, right? So for example, if you look back before 2000, before the year 2000, we didn't have that many therapeutics at that time. Okay, so at that time, the priorities were mostly basic, the genetics. Let's try to figure out the pathogenesis. Let's try to figure out what's wrong in a really deep manner so we can actually start to target certain therapies to that. And then over time, we've gotten several therapeutics that are being, well, one's approved, but several of these are being tried now. And so the priorities change over time. And so every year when we meet, we actually come up with new priorities. And a lot of that is to do with what's going on in the field in general, just in biomedicine in general. And so that just changes over time. But to change over time, we also do another thing. We change funding mechanisms that actually match the priorities, okay? Now, this might not make sense at this point, so let me just give you some examples, okay? So here's one where we said, early on, we had said, we just need more resources. So what do we mean by resources? We need better animal models, so mouse models, fly models, rat models, fish models. So these are models that you can test therapeutics in before you do therapies, before you test therapies in humans, okay? So once you make these models, the whole field benefits because somebody spends the time to make a better mouse model, but then that mouse model is now available to anybody who wants to study, certain therapeutics in that mouse model, okay? And the same way, we have better methods, better cell lines, better yeast strains, all kinds of things are developed over time. And so around $37 million have been spent specifically to making more resources like this available for the NF community. And this has created over 100 resources that are now widely used. So when you'll see somebody show results here, or here's this xenograft mouse model, or here's this, this type of, that mouse model is available, or those ideas are available to the whole community to actually use and test these things, okay? So here's an example of improving the resources in the community, and that elevates everybody's research at the same time. And this is for new investigators. So we had recognized quite early on saying, we need to bring either young new people into the field, so people who have finished their MDs, finished their PhDs, finished their fellowship training, and say, come into the NF space, okay? Or somebody who's senior and is an expert in certain areas, right? And that person is not working in NF, and we say, bring all your expertise and come into the NF space. And so we call both of these guys new investigators in our space. And so you can see how many new investigator awards have been made over the sort of 23 years already. And the amount of money that we actually spend in for new investigators is actually not that high per new investigator. It's a way to kind of bring them into the field. But the really cool thing about this is that they bring in new ideas, of course, but even for that small amount of money, they go on then and get NIH grants and other grants. And so this actually leverages the money that we put into that. So if we put in, something like $50 million, something like $62 million gets leveraged from other sources that then come into the NF space, okay? And 2/3 of these, so almost 60% of these people end up then staying in the NF space and actually become long-term NF researchers and improve the field in general. Of course, we keep looking for newer and newer people every year so that they kind of grows the field. And it's this growth of the field that is actually responsible for increasing that NIH funding. Because the more people you have working on NIH, the more grants you're going to apply to the NIH and more money is going to come to us from that. So you see how that thing snowballs like, so that's pretty good. And then, of course, over time, we've realized we've just got so many therapeutics that we need to test. So there's a clinical trial awards mechanism as part of this CDMRP program. And here are just some recent awardees and recent grants here. But the point here is that we've given out several clinical trial awards now. This is to improve the testing of therapeutics. But this is done one person asking for, or maybe a couple of people asking for an award, and we give it to them, okay? But I think one of the really cool things that CDMRP has set up is this consortium. That's an even better way to test therapeutics, right? So this is $35 million invested over the last 20 years. and it's resulted in 17 different trials. You saw this slide earlier when it was shown for the consortium. So you've got a total of something like 24 groups that are now part of this consortium. And so this consortium actually has an operations center and has these 15 clinical sites and 9 collaborating sites. So that's the 24 sites I was talking about. And then all of these, so this is not just saying, here, take this money and go do whatever you want. There's an actual governance system put in place where there's a steering committee. They actually report back to the NFRP, which is to the CDMRP. They also have an external review committee. So all of this stuff is kept, and then there are different disease committees and discipline committees. So there's a whole organization put in place that when this money is given, that all of these trials are set up in a defined manner, and good results will come out of this that can be believed by everybody. But you're also setting up the resources to be able to test future drugs better, because there's going to be coordination across these different, across the entire consortium that makes it a better consortium, a more efficient consortium to actually test therapeutics as they come about in years to come. And then lastly, I'll show you this slide here, which is, the whole point is we sit down and come up with priorities, but we don't know everything, right? I mean, there are people sitting out there thinking, oh, this is a pretty cool idea. Let's check this out for NF. And so we've got this special grant mechanism called the Exploration Hypothesis Development Award. It's a really small award, and it's given for, I think, 1 or 2 years. And we basically say, come up with a crazy idea. We don't even want to see any prelim data here. Just come up with an idea. If you've got solid rationale there, we'll take a shot on this one, right? And so we've funded several through this mechanism. It's not a lot of money, like I said. So it's 54 awards have been given out over the last, you just have to decide what kind of window you want to pick here. So this is 15 years. And so it's $2 million. Is not a small amount of money, but it's over 15 years. So when you think about it, it's not that much. And it's over 50 awards, but not all of these things pan out, because some of these are crazy ideas and you give it a shot and it fails. But some of these things actually take off. And look at that, from these 54 awards for 2.2 million, this has gone on to raise something like $16 million built upon this crazy idea that built up. And then somebody says, oh, now we're going to give you $1 million or $2 million of your own to go then flush this out and make it into a bigger thing. And so it's a huge investment on the return itself. But of course, we're not looking for money here. What we're looking for is crazy ideas becoming mature and then eventually developing into something that's helpful for the NF community. So I hope I've given you some idea as to where the money is coming from, but it's not just the federal government throwing millions and millions of dollars to whoever writes a letter to them, okay? It's actually a little more complex than that, where when it comes in, there are priorities set up, there's a whole review system put in place, and every time they come back for money, we're actually looking at how productive they were in the first round to actually justify giving them grants the next time around, okay? And it's not just scientists making the decision, but it's also people from the community sitting there making the decision whether something gets funded or not. So I haven't seen any yellow cards or red cards. I've got one more slide to go. And so here is, you have to take into consideration that they were messing with my, no, I'm kidding. This is my last slide again. So, we also recognize that, we cannot do this all by ourselves. Okay, so obviously the DoD has this chunk of money that's given for NF research. But we also recognize that we have partners at the NIH, for example. We have partners at CTF. We have partners at NTAP. And so actually in that little slide I showed you with the names listed of people who are on the programmatic committee. So we have scientists, you have NF specialists, you have consumer reviewers, but we also have representatives of CTF, NTAP, and NIH sitting in the room with us. So one of the things we learned from that is we actually find out what the NIH is also funding, because the person who's the head of the portfolio for NF research at NIH is on our programmatic panel, right? So when we say, oh, here's this new grant, she'll say, oh, the same thing is being done by other people, right? Or, oh no, this has never been done before. So that influences how we decide who gets funded and who doesn't get funded, right? So that's one thing. The other thing is, for example, CTF and NTAP, they set up a consortium, or they actually supported this NF Open Science Initiative. So, something that's really important is when you do research, you finish your research and you publish this research. The amount of time it takes from when you actually start the project to getting the results, to writing it up, and then getting it published, is quite a long time. Can be a couple of years, sometimes can be longer than that. And so we recognize that when somebody does any kind of research that is, collecting all kinds of data, we don't want that data just sitting there for 2 years, 3 years, 4 years before the research community actually gets access to this data. So one of the things we encourage is for people to submit their raw data into this Sage Bio Networks platform, which is part of this open science initiative, is to say, if you do a big screen or you do some kind of analysis that generates this large amount of data, deposit it into this thing so that you guys can analyze it, but other people can also sit down and analyze this thing and do other things with this and move it faster. Okay. And so we've actually created in one of our grant mechanisms a little supplement that if you actually make a credible case for saying in this much time, we will submit the data out quickly before this delay period happens, we'll actually give you an extra bunch of money so that this will actually stimulate other people to work on this stuff, right? And this came about because of the partnership with CTF and NTAP. Let me give you another example. So NTAP is, it's mostly focused on NF1, but one of their programs is to identify young people who are likely to become NF1 specialists, clinical and research people, okay? And not only do they identify these people, they actually set up a mentoring committee that makes these people become the future NF1 researcher or NF1 physician. And those guys are most of the people who apply to us in our New Investigator Award. So while they are identifying the right people and mentoring those people, when they apply to us, their applications tend to be the strongest applications because they've identified the right person, of course, but they've also got this nice mentoring team that's helping them write a good application. So when we're sitting on our side and saying, we're looking for talented new investigators, these guys are presenting them to us, right? So it's a partnership again, in that they are kind of finding the people. We don't have to go do that, but we have the money to actually support these people, and then we match in that room there. So this is just to say that the whole NF research program at CDMRP is not just doing it in isolation. It's also doing it in collaboration with other people who are funding or increasing the research resources in the NF field. So I'll just end by saying thank you very much for your advocacy and for your partnership. And I can guarantee you that anytime you write to your congressman, anytime that you support people like in the NF Central Plains, you are not wasting your time. Of course, it's great for people, but it's also great for the research. So thank you very much.